I think the benefit of the Zero Suicide Initiative in general is the fact that it's being talked about, above all else. I mean, we don't think about things unless they're constantly being brought to us. So I think the fact that it is bringing it to life is huge.
Some key ways to break through the resistance to the community wanting to address a community issue such as suicide is to educate them, provide information, not only statistics, but real stories sometimes, but provide training to help them feel comfortable talking about it, approaching people, and then ultimately acknowledging that we do have some people in our community that need help. We believe that community issues need community solutions, so we like to involve all community partners that work with community members that may be at risk. So we involve the hospitals, we involve social services, schools, we involve police departments and a number of other agencies, and we all work together to be trained so we can help work together, identify people, and help save lives.
Well, I think the #1 message that Zero Suicide brings to the community is that if you need help and you reach out, someone will be there.
For me, I link people to all different kinds of resources. I link them to the food banks. I might link them to family shelters, or to how to apply for Medicaid or things like that, because those, food insecurity and depression and all of these medical issues, they can lead to depression, which could lead to suicide. So especially as a mom, right, we have all of this weighing down on us. So anything that I can do to help make things better so moms can have a better outlook on life, I'm 100% for it.
Of the 7 core elements, I feel that training is really the kind of bedrock of all the other elements. It speaks to how we screen, how we safety plan, how we engage, how we support the workforce, and with continued evidence-based practices coming out and a very hungry workforce, right? Clinicians and peers, they're hungry for knowledge. They want to feel confident and competent in serving a population whose lives are at risk. And so if we provide good training, good evidence-based practice where people can feel confident, I think that will propel all of the other elements forward.
We've been able to train over 400 staff members with Rappahannock Indian Community Services about this Zero Suicide Initiative, as well as to do the gatekeeper training with those staff people. We believe this training will help them feel more comfortable talking to clients and talking about suicide, and help identify anybody in distress.
I think connectiveness is of paramount importance, because in this society where we think we're connected, we're not. We're not reaching out to each other, we're not talking to each other. In my work as a peer, substance use and mental health, a lot of people think drugs and alcohol are the problem. They're not, they're a symptom. The problem is not being able to connect, not be involved, not be a part of. So that connectiveness, to me, is the whole game. Like, it's what it's all about.
Communication is key in implementing this program in the community, to stay connected, keep the information out there with the community partners, and keep it in the forefront.
I became involved in suicide prevention work starting very, very young. I participated in clubs in school that talked about mental well-being, that talked about coming together and how we can support each other. And as I grew up, I took that to mean that this is where I was supposed to be.
So one piece of advice that I would give to somebody is it's okay to ask for help. It's okay, please always ask for help. You can call us, call our warm line, call 911, go to your local hospital, but please ask for help.
For the people on the front line, the key action people can take to help save lives in our communities is to be trained and feel comfortable approaching someone in distress, recognizing those signs, includes approaching them and feeling comfortable and talking to them about what they're feeling, what they're experiencing, and not to be afraid to ask the question, are you having thoughts of suicide?
We have to make it okay to talk about suicide.